Last night. Because like if there's 8 different characteristics, but they're divided into 2 different groups. So the first 4 look at more of the acuity, medical aspect of the patient, and the last 4 look at more of their capability, like how much are they involved in their care, in the decision making, in their activities of daily living. And then based on those numbers, then we try and make a fair workload.
Hi Frank, how are you doing? I have some Tylenol for you.
They are a less acute patient, they'll be with a newer nurse. And so if they have something more acute, they'll be with a more experienced nurse. So it's going to be safer for them in the end, because they're going to have somebody with the experience that they need to treat them when they need that treatment.
The wait times for operating room, not.
Do it again?
You're good at that.
If we can assign a score saying that, like, look, these patients are too sick for the level of staffing that we have, we need extra set of hands, then that will provide safer patient outcomes because it will give you more time with patients.
Is it no background noise?
I assume no background.
The tool promotes teamwork in that the way that we've structured it here on Sixth Medicine, the staff get together and talk about their team while they're filling out the tool. So they have the conversation about, okay, Mrs. X in bed 1 has her acuity is this, her resilience is this, she has a lot of family that ask a lot of questions, so maybe her participation in care is quite high. And those types of conversations weren't happening before, or if they were, it was in a very superficial level. So just in the fact that when you're filling out the tool, or when you're talking about filling out the tool, it increases that communication piece. That communication piece ripples out to the rest of the care that's given that day.
I think what drew me to the project and got me interested in it was the aspect of nurse-patient ratios. We know that people can come to work and give 120%, but if the workload is too great, they still can't achieve the goals that they've set out for themselves as their professional goals into caring for their patients, and they go home frustrated because they weren't able to provide the care that really was required. They're often just sort of skimming the surface on the must-dos and not getting into a lot of why we went into nursing, to be with people and to help them through difficult times. And I think that's what discourages nurses, is not that personal time for patients. That's what draws us to nursing, to support families and patients through difficult times. And when we have to sort of just concentrate on the tasks of nursing, it becomes a little bit discouraging for people.
Recruitment-wise, anything that forces you to take a look at your teamwork, advances the scope of practice and expands what you're doing, increases patient care, you get a reputation for having those things, and then your recruitment's done for you. You don't have to do anything, because it's the culture of your unit that this is a place that I want to go and work, because I've heard that Sixth Medicine has impeccable teamwork, they have great patient care, and I had a friend whose mother was there and she had the best hospital stay ever. Those are the kinds of things I want out of my unit.
This is a collaboration between the Ministry of Health, the Saskatchewan Union of Nurses, and the Saskatoon Health Region. And that means we have a genuine collaboration of 3 partners that is making all of this work, providing the funding, the research, and the logistical support to make this happen. The collaboration is really unique, and it's a really powerful part of the project.